Posso? Sì. Vorrei fare una domanda al professor Fuentes. Posso?
Certo.
Dottor Fuentes, noi abbiamo 2 figli autistici e sordi, di cui uno, sono adulti ovviamente, e uno di loro, grazie al cielo, non prende niente, assolutamente niente. L'altro, che ha circa 39 anni, prende da anni un cocktail di 7 medicinali, fra cui benzodiazepine, neurolettici, più gardenale, e vorrei sapere se facendo un'azione, non so, cercando di spiegare allo psichiatra quali sono i nuovi sviluppi in questo campo, qual è la speranza di questo ragazzo di un giorno diminuire questo cocktail di medicine. E come genitori non abbiamo molta forza, ovviamente, per convincere lo psichiatra a rivedere un po' questa sua posizione. Che speranze abbiamo? Grazie.
Works now? This one. Okay, thank you for your question. I don't think that I should be able to reply to the single situation of a single person. I don't think it's fair for doctors to give practical advice or practical opinions to refer to patients who we do not know. So I cannot refer to your son, but I will challenge a few things that you said. First, I will not say thank God that the other one is not taking medication. I think that the right approach is the person taking the right medication for something that he needs the medication for. In other words, I don't think that medication are poison. The trouble is when you over-medicate people, when you give medications that are not well-deserved or well-studied. So my hope will be that maybe in 30 years from now, we will have medications that will affect maybe before the symptoms present, or maybe the core symptoms. In other words, I don't think that we should have the feeling that medication are by internal characteristics something that is bad. Medications save lives. And I think it's important to realize that medications can be good. First point. The second point, it's true that we have seen here that people with autism spectrum disorders are over-medicated all around the world. And the less services you have, the more over-medicated you have. And we compare the 80% in some countries to a 23% that we have in our province, and the less than 30% that we have kept for 12 years. I think it's not only a scientific problem, it's an ethical problem, in my view, to try to substitute good care for good or bad medication, but for medication, okay? But the point is not going against medication. For me, the point is going against lack of services and lack of support. Now, in terms of multiple medication, I think that in psychiatry, there is a tendency to try to think about having one single medication that will fix all the problems. And we all like to go for monotherapy, that's true. But in medicine in general, that doesn't work. In medicine, if you have, pneumonia, you need one medication, antibiotic, then you need another medication for the fever, and you need another medication for your breathing, whatever. So in theory, it's not bad. The trouble here is to be right in the choice of medication. Now, 7 medications seems too many in principle, but I cannot judge your case. Our pharmacist in the clinic, she says that when you are over 3 or 4 medications, the combined side effects positive and negative. Although these 4 medications are not understood. So you risk in getting into a desert, a land that nobody knows. But my point here will be that we should come up the session saying medication might be very important for some people. We should keep hope for the future in terms of newer medications that will be safer and that will be more effective. And in the meantime, we should not forget that medication is not the treatment of autism. Education and social services and development of social communities are the treatment so far. Maybe in 30 years, we'll have drugs that can alter the protein mechanism. And it will be fantastic for all of us. So I don't agree with the negative beyond that. Thank you.
Ci sono altri che desiderano? Prego. Direi che questa è l'ultima domanda, così abbiamo tempo per un break velocissimo. Prego. Arriva il microfono.
Buongiorno, mi chiamo Anna Maria Angelilli e... Mi sentite? Buongiorno, mi chiamo Anna Maria Angelilli e tra 20 giorni mi specializzo in neuropsichiatria infantile. Avevo 2 domande da porre a tutti voi. Una, considerando la differenza di prevalenza tra maschi e femmine nell'autismo, se nella vostra esperienza vi siete trovati a dover gestire differenti sintomi associati all'autismo nei maschi e nelle bambine, e se avete trovato differenti pattern elettroencefalografici tra maschi e femmine. Grazie.
È la classica domanda da $100.000. No, in realtà appunto è talmente sbilanciato il rapporto proprio epidemiologico che rispetto a questo, nella mia esperienza e per quanto ricordi con dati in letteratura, ma chiederò sicuramente l'aiuto e l'opinione del dottor Fuentes e di tutti gli altri colleghi, non ci sono differenze statisticamente significative, o perlomeno sembrano esserci un pochettino con alcuni quadri di comorbidità le stesse differenze che si descrivono in alcuni quadri clinici psichiatrici che, ahimè, non so se è giusto questo commento, vedono quasi sempre il sesso maschile un pochettino più affetto da una serie di patologie. Per quanto riguarda invece l'epilessia, non ci sono assolutamente differenze statisticamente significative tra maschi e femmine.
No, can you use the other?
No, I mean we treat the problems regardless of the sex of the persons, and you have to assess in each person what are the problems. And medication may be useful, but let me tell you that for behavioral problems, positive programming practice is much more effective. So you go first with the most effective things. And if you need medication, you can add medication. But remember that as a newcoming psychiatrist in the field, remember always to think in the person and then to think in other alternatives that combine. The multimodal treatment is not only for ADHD, the multimodal treatment is everywhere and should be everywhere. We have to combine different aspects of treatment: education, information, medication, all this. Thank you.